All right, let's talk about a medication you're going to see in the hospital often for patients. And once patients end up in the hospital for some time, you generally end up on bowel protocol. And then what can happen on bowel protocol is they end up with diarrhea. And so then we start giving these types of medications to try to counteract that, okay? So this medication is Diphenoxylate-Atropine, okay? Trade name is Lomotil. So maybe that's what you've seen it as. The indication for this, like I just said, is going to be treatment of diarrhea. And the way that it treats diarrhea is it actually inhibits GI motility via anticholinergic effects. Remember, with our anticholinergic effects, we're talking things like slow GI motility. We're kind of talking our fight or flight system, right? So we're going with these anticholinergic effects. We're going to slow that GI motility. Okay, so therapeutic class is antidiarrheal. Pharmacologic class is anticholinergic, okay? So there's some really important things to keep in mind anytime you have a patient taking these types of medications. First of all, with this medication, it's very important to understand and remember that it's contraindicated with angle closure glaucoma, okay? Now, something unique to this as well is that it's structurally related to opioids. So we want to use caution with patients that have allergies to opioids. If you have a patient who's allergic to morphine, which you will see every now and then, you want to use caution with those types of patients. Side effects, remember we talked, it has these anticholinergic properties. That's kind of how it works. So some of the side effects to keep in mind are going to be constipation, tachycardia. It can also cause dizziness, and they can cause ileus, okay? If we're slowing that GI motility, the patient can go on and develop an ileus, all right? So one thing to keep in mind with this as well, and this will happen a lot with these patients, is you want to tell them to take the medication as prescribed and not to double dose, okay? Sometimes these patients will be experiencing diarrhea. They start taking Lomotil, and they really want the diarrhea to stop, so they overdose on it, and that turns into an ileus, and then that turns into them having to go back on like a bowel protocol, and it just kind of becomes this cycle. Also, keep in mind with these patients to monitor liver function, as this medication is excreted by the liver, so it's really important to kind of keep that in mind. But that is Lomotil. Just the big things to keep in mind are angle closure glaucoma. Just kind of keep that in mind. A big thing that you'll often see on tests is just about the importance of taking this as prescribed, not double dosing, not skipping a dose, etc., and let the medication kind of take its course.
This has been another episode of the Nursing.com MedMaster Podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.